Welcome, folks, to episode 26 of Finding Your Hidden Superpower, Autism, Aspergers, and those of us who are neurodiverse. So, today I want to talk about the prevalence of autism and the diagnosis of autism. I've already gone through what diagnosis is, but there's in this article from February 10th, 2022 from Stat News. It says there is no autism epidemic, but there is an autism diagnosis epidemic. Now, back in 2000, year 2000, there was a study that came out that said that 1 in 150 people had autism symptoms. And then in 2016, it was revised to 1 in 54. And now it stands at 1 in 44 children are diagnosed as autistic. Now, the question is, what is this an epidemic of people becoming autistic because of environmental issues, pollution? There's conspiracy theories all over the place. But the bottom line is that what's happening is that people are going and getting diagnoses. Also, the DSM-4, which was revised to a new DSM-5, which is the Diagnostic and Statistics Manual for Psychiatry and Psychology. So they lumped Asperger's in with autism. So before there were Asperger's people and there were autistic people. Now it's all considered autism. So that's going to increase the numbers by a lot, number one. Number two, now that people are forced to have insurance, they're actually insisting that their children get diagnosed and at least tested to see if they are autistic or not. And one of the things with the diagnosis of autism is more the outward expressions of the child, because it's an inward manifestation that when somebody is not able to handle all the information coming in from their environment, they get triggered and they act differently than people that are neurotypical. And so therefore they get the diagnosis. And so one of the things is that there's a change in diagnostic criteria, and so a lot more people that were on the border are now, because it used to be that in the DSM-4 you were either labeled or you were not labeled. There wasn't called spectrum, in which the DSM-5 changed a lot of, especially psychiatric diagnoses. Now they put them on a spectrum, on a one scale 1 to 100. Let's say if somebody, now they can, instead of having a cutoff point, you have more of a spectrum, whereas people can land high on the spectrum or low on the spectrum. They can, not manifest the symptoms unless they're stressed, and then some other people are constantly stressed, so they're manifesting the outward symptoms. So, environmental causes like vaccines, there's no evidence for that explanation. There's no evidence to prove that vaccines cause autism. One of the things is that, because the information age is more and more distracting, more and more people are going to be triggered, and because internally they can't handle the input, and then they'll get triggered, and then they'll manifest these triggers into dysfunctional ways that they're relating to other people. So, in the book Autism Matrix, sociologist Gil Ian explained that the diagnosis of autism fits the message of the deinstitutionalization movement better than mental retardation, because the public believed that children with autism lagged behind in only some areas and could improve with behavioral therapies. In contrast, children with mental retardation were believed to lag behind in all areas and could not improve with therapy, justifying banishing them to institutions away from society back in the 1960s and previous. So, if a family wanted to protect their child from being institutionalized, they would just deal with it on their own and not have a diagnosis. Because if somebody's going to be institutionalized for being called autistic or mentally retarded and locked away and have the key thrown away and be put on major drugs that just dope them up, a lot of families are not going to want to check out whether their child is autistic or not. So um, it and a lot of these studies, when they look at large populations and the prevalence of autism, they find that it's pretty much evenly distributed, but there and when it's not evenly distributed, it's shown that some factors like being able to get access to medical records uh, shows it's because different states have different laws about privacy. So you might not even be able to look at anybody's records, even when they're anonymous, you know, when the names are anonymous. But so um, what it's showing is that yeah, there was an 18% increase after the mandated insurance, and that's because people were able to actually, autism is being destigmatized, and people are able to get medical access and get diagnosed. And so also the people that are getting increase in diagnosis, they tend to be less well off than the people that already have had medical diagnosis and weren't affected. So that's another reason why the numbers can go up. So yeah, it talks about it's easy to believe that disease categories simply report divisions in nature, but political and social factors also affect disease rates as well as who receives treatment. Autism rates aren't spiking because more children are developing this condition, but instead because the deinstitutionalized movement, insurance legislation, and data collection methods have gotten better. These social factors control which conditions receive more funding for treatment and research, and have helped create a system in which children with developmental disorders often cannot get the support they need without diagnosis with social influence. Even they are even powerful enough to fuel an epidemic. So the bottom line, to close this up, is that even though these statistics show that autism is going up, it's more that people are able to get access to insurance and diagnostic tools, and their insurance company is actually covering this testing, and so people don't have to dump a bunch of money out of their pocket. And so the rates are obviously going up because people have more access to healthcare. So with that, no, autism is not caused by environmental causes. It's more of an internal state, as anybody who's watching this should know, and it's reactions to too much data input. So, with that, Have a good day.